Thank you, Madam Chair. Distinguished delegates, I have the honor to speak on behalf of the IFLC and the 191 national Red Cross and Red Crescent societies who are contributing to the implementation of the drug policy commitments as set in the Ministerial Declaration, especially on the challenges connected to health-related aspects throughout its volunteers and professionals that every day alleviate human suffering within the most marginalized groups and settings. IFLC started long time ago to address world drug problems since the Bangkok conference in 1922 and committed with specific resolution on substance abuse at its highest bodies to mobilize for the prevention, treatment, rehabilitation of people with drug disorders, also by broadening the cooperation with WHO and other governmental and non-governmental organizations in the past decade. IFLC recently developed a common platform with civil society organizations, activists of human rights, community leaders, experts, and public authorities from across the world to explore ways to combine humanitarian attitude and policies in health, criminal justice, prevention, and community responses to addiction by promoting a shared statement called the Rome Consensus 2.0, a kind of manifesto. The sense of this humanitarian drug policy declaration comes from the need to give emphasis to a more human attitude in support of people with drug disorders and focus the attention on those who are struggling with their disease every day. IFLC stresses the central role of communities, civil society, and local frontline workers, especially former drug users, that with their background experience should be considered an added value in the therapeutic context. A well-applied practice of Villa Marini Foundation, the training center of the IFLC on drugs, where professionals meet and treat 700 people a day from 45 years, and thanks to the former drug users every day avoid the overdose of many in the streets with the naloxone and harm reduction programs. The modern drug policies should feature more explicitly the essential contribution of former drug user work. Equity must be a prominent part of national health and drug policies. IFLC recommend strengthening equity and equitable access to health for all. According to the World Drug Report, since years, only 1 in 5 individuals with drug-related disorders have access to treatment, and women and transgender encounter additional barriers when accessing these services. With this speed, we will not achieve universal health coverage and create a tangible impact on the world drug problem. It should be in the interest of every government to improve health conditions of millions affected if we want to build safer communities. There is overwhelming evidence that drug use undermines security in many regions and evolve into major threats for political and social stability, human rights, and economic development. Universal access to treatment and humanitarian drug policy are the best and most effective options we have in our ends. Thank you.